Hello everyone, I'm sorry that I couldn't be with you today, but I'm glad I had the opportunity to share my voice in this amazing space. My name is Alejandro Dali, I'm the director of El Derecho a No Obedecer in Colombia and a UNICEF consultant. I work in issues related to air pollution and environmental action in Latin America and the Caribbean. I know, as you all know, that the climate crisis is also a health crisis. Just talking about air pollution, more than 7 million people die every year. And we're not only talking about air pollution, we're talking about obesity, we're talking about mental health, and many other issues related to the climate crisis that we know directly affect our health, and especially the health of young people. If you want to involve more young people, I invite you to do 3 things. First, we need to create public conversations. This is one, but we need to do many more, and we need to invite people with different backgrounds. We want intersectionality. We want young people, we want Black young people, we want indigenous communities talking about the health effects of the climate crisis. Second, we need more networks, multi-sectorial networks. We need the private sector, we need the public officials, we need the media, the activists to work together to fight the climate crisis. And third, and this is something I strongly encourage you to talk about, we need new narratives. We need new symbols that inspire young people to fight for the climate crisis and understand the health effects that the environment and the climate crisis are having in young people. So I hope you have the opportunity to discuss these 3 things and to inspire many young people all over the world to keep up changing the narrative, to keep up creating new symbols that people can relate in order to fight climate change and their health effects. Thank you.
Without further ado, over to our panelists. Thank you.
So, good morning. Thank you all for joining us today. My name's Juliet White, and I'm very proud to be here. I've worked for AstraZeneca for many, many years. And I was reflecting on watching David Attenborough last night. And I don't know how many other people have seen the clip that circulated many times, but the phrase of "the world is looking to you" really struck me. And I'm a mother of 3 kids. They're teenagers and in their 20s now, and I know that they're looking to me to make a difference in the same way as I'm looking to you to be part of making that difference. You heard the comments there that kind of health, climate health, human health are inextricably linked. We know that when we have poor air quality, we see increased respiratory disease. We know that in times of extreme heat and extreme drought, it's often the most vulnerable in society who are impacted, the very old, but the very young, by cardiovascular or respiratory issues. There was a study recently done by UNICEF that talked about the Child Climate Index. I don't know how many of you have seen that. But it was an astonishing and frightening figure. 1 billion children, that's 1 billion children, half the world's population, live in countries that are exposed to extreme climate risk. That's a really frightening thought. And I do think when I talk to my own children, young people do feel frightened about the future. That kind of phrase, desperate hope, now is a moment to give people some desperate hope. The University of Bath conducted a study of 10,000 young people in 10 different countries, and 75% of them said that they find the future frightening. As a mother, as a parent, as a member of society, I think we have an absolute responsibility to give our young people the right to a future where they feel secure, a right to good health, both for themselves but also for the planet. Now, we can't do this on our own. As I said to you at the very beginning, I've worked for AstraZeneca for more than 30 years. In my early 20s, I started. And most recently, I've spent my time working with the COVID crisis. That's been a once-in-a-generation crisis that we've been part of. But what it taught me is that actually we can't find our way through this when we do things on our own. Collaboration and working together is the only way to achieve sustainable change and to make outcomes happen. We need partnership between individuals, between companies, between governments, and between organisations so that we can truly collaborate. The COVID crisis taught us that we can innovate, we can make change happen quickly, but we can't if we don't grasp the moment and we don't act with a sense of urgency. I'm pretty proud, although I'm a corporate person, I'm actually very proud of the organisation that I've been part of for so long. And I'm proud of the commitments that we have made to a more sustainable future. I'm proud of the investments that we make, the actions that we take. But I also want to be part of a system where actions speak louder than words. And the investments that we make, the commitments that we deliver upon, do deliver better health for everyone, planetary health, but also human health. But we can only do that when we work together, whether it's working with colleagues on the stage here, working with all of you in the audience physically and watching us, when we work with groups such as One Young World, UNICEF, SMI. Collaboration is the only way that we are going to work together. One of the things that I was struck by is there's been a lot of talk about time and people using different concepts of time. Some of you may have seen Boris Johnson use a sort of James Bond analogy in that now is the minute to midnight. I took my inspiration, as will others this week, I'm sure, from Robbie Burns, a poet a little bit closer to home, who said, now is the day, now is the hour. I think now is the second, and it's the second that we need to get into some conversations. Firstly, I'm going to take some conversation with Jordan and Sophie, but then most importantly, we want to take some conversations with all of you. So Jordan, I'm going to take a seat next to you, and maybe we can start talking a little bit about your view on the sort of impacts of climate on human health.
Sure, and thank you, Juliet. I mean, no surprise to anyone in this room that your human health is intimately related to the climate. I mean, you mentioned it up at the top, air pollution, the water we drink, the food we eat, the things we see fundamentally impact our physical and mental health. But there are two serious climate risks at the moment that seriously pose threats to our human health, long-term and in a serious way. The first, as you said up top, extreme heat. 200,000 people died in the UK last year from extreme heat. Now, granted, and maybe we'll get into it a little bit later, granted, the majority of people who are at serious risk of extreme heat are those at much older end of society. And people are seriously being admitted into hospitals with, dehydration, acute kidney injury, first-line sort of heart failure associated with low blood volume. And what you're seeing here is summer crises. In health systems, we don't get this. We only get winter crises. Now, the impact of that in the UK is severe. The impact of that globally is far more severe. The UK is not the hottest place on Earth by any stretch of the imagination. The second is flooding. Flooding is not often associated with serious health risks because, sure, you may lose some of your possessions, maybe memories and photographs. It's an extremely traumatic experience, but you're not going to be physically harmed usually in flooding events, certainly not in the UK. However, flooding, there's been a lot of research in recent years looking at the impact of flooding on people's mental health. 1 in 3 people who were impacted by flooding at home will suffer PTSD at some point later in their life. They are at 4 times the risk of serious mental illness later on in their life. We are building up to a serious mental health crisis intimately linked to our environment. You compound that in other environments where you are exposed to other serious climate acute risks in the home, in your place of work, and that compounds. 1.8 million people today in the UK live in areas that are high risk of flooding. That's set to rise to 2.6 million by 2040. So the bottom line is, yes, our environment today is fundamentally related to our health, but unless we get on top of the climate crisis, unless we address the fundamental issues that we're all here to sort of address at COP26, we are exposing ourselves to serious health crises, both physical and mental.
Sophie, what about your thoughts?
Yeah, absolutely. I think mental health is a really key theme from the work that I do. So I've chaired this year's Youth 7, the official youth engagement group for the G7. We surveyed 2,000 young people across the UK, nationally representative. And what we found from them was the biggest priority in terms of health that they faced was mental health. That was 56% of young people said it was the biggest priority for them. That's double anything else compared to pandemic preparedness or vaccine distribution and equity. But importantly, there were big kind of geographical variations in that. So in Scotland, 3/4 of young people said that mental health was their biggest priority. when we asked them kind of, why, what's the problem here, they told us half of young people said that governments were not doing enough to tackle the root causes of mental health conditions. And I think this comes back to Jordan's point, actually, that what we're failing to do is tackle the systemic, structural issues that are affecting people's stability. So things like housing, particularly when you're thinking about big climate events like flooding. We're also talking about things like poverty, where we know that the most vulnerable people are affected by climate change. They are the people who are most likely to suffer from mental health conditions that are related to the kind of inequality they are experiencing. And young people are saying, this has to change. But governments aren't looking at those systemic issues, they're just looking at the symptoms.
So, Sophie, I was struck by something that you said that young people are saying, but is everyone listening? So from a young person's perspective, what are some of the kind of biggest barriers? I know my kids talk about kind of hear me, don't just pretend you're hearing me. But what are some of the biggest barriers that you experience young people saying in terms of getting their voices heard?
I mean, there's a lot of them, I guess is the first one. I think there's a couple of things. The first is, and I look at this from a very kind of systemic way. I'm a kind of leadership development expert. I'm not a climate or a health expert. And the way I look at this problem is we aren't giving enough space to young people in all parts of the problem-solving process. And that is resulting in these crises, these kind of interconnected crises. So I think there's a big problem, first of all, in problem framing. I don't think we have enough people speaking to world leaders or even just organisational leaders about how we frame issues. Prime example is with mental health. When we spoke to world leaders, when we spoke to chief negotiators, they told us, mental health isn't our thing. Sorry, guys, that's a domestic issue. Like, we don't touch that stuff. And actually, I'm certain that maybe 20, 30, 50 years ago, people were talking about climate change that way. They were saying, flooding is something that happens over there. It doesn't happen to me. I'm not going to bother with that. And the longer we continue with that problem framing, where we don't even ask the right question, we're going to struggle with getting the right people around the table. The second bit is problem diagnosis. So we just don't have the right people around the table to identify the risks properly and to discuss those in full detail. Prime example is, 44% of young people that we surveyed said that world leaders did not listen to them. That is huge. The other thing is 2% of all parliamentarians globally are under the age of 30. Despite the fact that half of the world's population is under the age of 30, we do not have the right people being able to pinpoint the problems. And then finally, I do think there is something about not listening to the solutions that young people come up with. And that is partially because we don't value the perspectives of mostly marginalised groups. Young people are one of them, but you will have heard from things like, the climate justice and gender equality campaigners that actually, women and girls, indigenous peoples, they are not considered enough in solutionising. And I think really here, it's that sometimes the most important solutions are the counterintuitive ones. I used to work in risk management, and we worked in Iceland, and when a volcano erupts in Iceland, actually, the evacuation procedure often isn't to run away from the lava. It's to run towards the lava and to find the higher ground, which is often further up the volcano. And for ages, no one would listen to that answer because they were like, well, that's a stupid idea. You don't run towards lava, right? And I think that's the point. Unless you work with the communities who are genuinely affected by these things, you aren't going to come up with the right answers. And because we don't give young people a seat at the table, my second point, there's just not enough youth representation, we're really struggling to have those voices heard.
So can I kind of build on that and Jordan, maybe pull you in a bit? It's a really interesting reflection you made about kind of a voice at the table. To be a bit controversial, my sense is that there is an increasing voice at the table. The question is it a wide enough voice? And is it you're invited to the table, but you can say something, but don't stay for all of the conversation? Kind of how do we solve for that problem of not just inviting in when it's either convenient or paying lip service to it, but actually listening in a sort of truly sustainable way?
Yeah, I mean, that's a much bigger question. I think there are, in my mind, two components to the way in which young people are able to engage with a lot of these issues, both in climate and in health, and actually more broadly. I think the fundamental piece is young people are often viewed as their own stakeholder group. And what I mean by that is, you're the young person, you need to tell me about young people issues. I don't want to hear about health issues, I'll speak to the health specialist. I don't want to hear about climate issues, I'll speak to the climate. I want to hear about young people issues. And so what happens is the entire cohort of people's views are condensed into a subset of issues where they have a voice. If they say anything outside of that narrow field, they are sort of sidelined, removed, and don't have a voice at the table. And so they are subject to speaking about a very narrow set of issues for which they actually can leverage their position at the table. I think that's problematic for two reasons. The obvious first one being that young people do care about a lot more than just, quote unquote, young people issues, whatever that even means. But the second is, what you're doing from the outset is alienating the most important group when it comes to things like climate, and even health. Because what really matters are what are we building for tomorrow. Health systems today are not suited for health systems today, forget tomorrow. And the climate, at the end of the day, it's really compounding and it's going to affect younger generations. And so in my mind, what we need to be doing is at least opening our minds to the idea that young people have things to say other than just about young people issues.
So to take it to the next level, listening to that, making sure young people have a voice on not just young people's issues. What are some of the uncomfortable things that we're then going to hear that we might not like, that we're going to have to get used to? Because we can all have a safe conversation. It's quite hard not to nod and agree, but what's the kind of difficult conversation that isn't being had?
Yeah, there are many difficult conversations. In my mind, the biggest one is intergenerational tensions. We saw this in COVID. COVID is a fantastic use case that everyone in the world pretty much went through the same cost-benefit analysis. COVID, by and large, not exclusively, but by and large, will seriously affect older cohorts of adults. The burden of the responsibility in terms of mitigating against COVID disproportionately fell on young people. No more university in person, no more in-person work opportunities. I'm really sorry, but all social activities are off the table. This disproportionate imbalance in who bore the responsibility for containing the COVID virus and who was seriously at risk. That's a very crude generalization, but that was pretty much the assessment we had to make. And the same is true when it comes to the climate crisis. At the end of the day, when it comes to who's going to bear the brunt of the implications of climate change, again, it's an intergenerational issue. And the same again for healthcare. Unless we reform health systems such that they're more sustainable and they're more preventative oriented, again, it's going to be young people they're going to face. And in my mind, we're not yet even at the beginning of digging into what this intergenerational divide looks like. I think it segments through society in many, many different ways. You hear about generation rent and generation landlord. You read about issues that pertain to, why are wealth imbalances so different, and why does wealth tax not cross society in the same way. And we can go into the whole domain here. And I think what we're sitting at the cusp of is a serious divergence of opinions that COVID sort of laid bare in a way that we hadn't seen before, in which climate and health crises are going to expose further.
Yeah, I think that's a really valid point, Jordan. And I could talk for days about kind of intergenerational challenges, and I think I'll take a slightly different perspective on this one, which is actually I do think what we need to start talking about is how much we trust and rely on international systems. So as you say, the world has eyes on COP26. But actually, if you're speaking to people in advance of this, not that many people were that optimistic about it. These big events that have the eyes of the world on them, actually people are starting to become a bit numb to the fact that they seem to promise lots and deliver very little. And I think we need to start persuading people of the importance and the power of multilateralism and international cooperation. So this is a finding that really surprised me. When we surveyed those 2,000 young people in the UK, we asked them, how would you like the UK to approach the next pandemic? So if it were to happen again, what would you like us to do? Would you like us to take a more international response or a more domestic response? And actually the answer was split. And that really surprised me because I expected young people to say, we wanted you to take a much more international approach in the same way that we're taking to climate change. And I think what that means is that young people are still not persuaded of the importance and the influence of these big events. So I think what we need to be talking about is how do we make these conferences more than just conferences? How do we make them more than just talking shops where people actually step up and deliver things? And that comes from, I think, living true to commitments. We haven't been financing developing countries, even though we committed to that 6 years ago. I think it's a really important thing that we don't just talk about new action, we actually consolidate old action to persuade people that these fora have value and are worth our time and money.
It's an interesting perspective, this kind of intergenerational, and I'm sitting on the stage probably at a slightly different generation from you guys. And your reflection on the pandemic, I'm also reflecting on that whilst I recognise my own children probably made the most fundamental sacrifices, the absolute reality is my day-to-day life, they said to me, didn't particularly change because you didn't really do anything with it anyway, so their lives did change. To kind of slightly take a different view though, Jordan, I think in some ways it had the opportunity to bring us closer together across generations, because actually what I saw is young people saying, I'm making choices because I want to take responsibility for mum or granddad or the lady next door. And I saw a coming together that probably I hadn't seen, at least in my lifetime, to the same extent. Now there's a big shared concern, our own basic health. It was probably the first time most of us living, certainly in the UK, felt that our day-to-day health was under threat because we don't live with the same climate threat, but there was a threat out there that we couldn't see in the same way as people can't see climate threat. And we were scared. I was scared. I was scared for myself, my kids, my kind of elderly relatives as well. So it did give me some hope that became a bit of a tipping point to bring the generations together. But as someone who sits in a different generation, what would you tell me I had to do to keep that spirit alive?
Well, that's a tough one. I think first of all, I think you're right. I do think for the first time we've seen a much more shared appreciation of the challenges being faced between generations. And I think that's going to be important going forward, because certainly from a healthcare perspective, young people are going to have to make a lot more sacrifices in order to sustain and pay for health systems, in order to ensure that health systems move towards preventative disease, in order to protect primarily older people from the risks we discussed earlier, like extreme heat. I think it works both ways, though. I think fundamentally we're going to need to see a generational appreciation of the challenges young people are facing and how we can move the needle to ensure the world tomorrow is actually better, so that we're not scared of tomorrow, so we're not worried that tomorrow's world is going to be worse than today's. I think there's the big one, which of course is climate. How do we sort of bridge the known divide towards opinion and the sacrifices willing to be made to decarbonise society and to decarbonise systems such that we can meet 1.5. The other piece is, I think, we have to get to a position where we no longer view a lot of these problems as just being young people problems. It is affecting the future. It is going to be worse for younger generations. But we are now in 2021 at a point where it's affecting everybody. You know, I mentioned earlier the extreme heat example. That's pretty much exclusively affecting older generations. It's now at a point in time, for the first time I think in the history of the climate change crisis, that all generations are actually facing the crisis head on together. And it's an opportunity for us to come together and start looking for solutions and building sort of intergenerational support rather than maybe some of the more controversial points we outlined earlier.
What about you, Sophie?
Yeah, I 100% agree. And I think so this year with young people, we could only get a seat at the G7 table if we explained why we cared about this problem, why it affected young people. And we deliberately chose our theme this year, making waves for future generations, which I actually feel is a very apt time for me to say that, because we are actually moving slightly on this boat. I don't know whether anyone else has experienced it. I'm starting to get slightly seasick. So we chose the theme of making waves for future generations because that was the only way we got our foot in the door into these conversations. Now, I genuinely think, I would hope that what we've done by putting our foot in the door and staking that claim is that we've proved that young people are credible, that they have valuable insights that can extend beyond just young people issues. And that instead of seeing us as kind of pitting generations against each other, which, let's be honest, makes for a great news story and great kind of media sensationalism, actually doesn't help us solve the problems that we're facing. And view it as actually we have shared problems but different perspectives, and opening up the voice, the doors not just to young people, but to Indigenous communities, to women and girls, to LGBTQI campaigners. We really need to be opening up these spaces because and that's the way we're going to solve the problems of the future, and that comes from not asking people to justify why they're at the table.
I think one of the things that you've just talked about is this kind of not pitting against each other, and often the sort of sensational media stories that go with it. So I'm going to take the privilege of maybe asking one final question before we come to the audience, and maybe give us a bit of a break, because we are swaying quite considerably here. The last time I swayed in a nightclub was many years ago, I have to say. But I think if you were to sort of say your hope for coming out of COP, the one thing that you'd like to be really different, either because you're here, because others are here, what's that one kind of, I guess, reflection that you want in 2 weeks' time to step back and look at and say, wow, it was worth it?
For me, certainly, I think historically we've viewed health and climate as two independent variables that we don't think about together. I think what I would love to see and what I really am here for is, can we put the healthcare system, the way in which we run healthcare systems and the way in which we engage with our healthcare, and frame it fundamentally as a climate issue. Fundamentally start thinking about, at the beginning of the COVID pandemic, you'll remember we spoke a lot about saving the NHS, saving our health system. It no longer is the case. Fundamentally now, looking after your own health, building sustainable health systems, putting preventative healthcare first, we are saving the climate. And we need to be thinking of healthcare very much in this lens if we're going to make the transition.
Really powerful.
Absolutely. I mean, I think I'll go back to my point, which is we just need to stay true to our commitments. I think we need to see, developed countries living true to their commitments of supporting developing countries. I also think we need to see a real action on keeping 1.5 alive, and I think that's going to be the thing that I really want to see coming out of this. But finally, I really do want to see, global powers taking action to address the systemic issues that are affecting climate change. All too often, I do think we hear too much about the individual consumer behaviour changes, which, let's frankly, when it comes to things like either kind of health or also climate change, they are important, but they are small fish sometimes compared to the big things that big players can do. And I really want to see ambitious and powerful commitments coming out from world leaders, but also from organisations and corporations around that.
Really, really powerful comments about systemic change, because systemic change is considerably more sustainable. I think, Jordan, I'm also really struck by your comment that actually when we take care of the planet, we take care of our health. And if we think about prevention rather than cure, how much more powerful is that, both from a health perspective, but actually the sort of well-being of everyone as well. So really powerful insight. So we want to honour our commitment. And our commitment was that we would turn over to Alex, that we would take questions in. I hope they're coming in online or in the room.
We've already got 6.
Okay, good. So hopefully we've protected the time.
Absolutely, absolutely. Bang on time. If there's any questions from the audience, we can take those as well. We do have some online as well, but let me take some questions from the audience if there are any. If not, we'll go online.
No.
I think there's a switch on it.
We can hear you.
Yeah, we can
worry.
hear you. We can hear you. I can hear you well.
I'm like the guinea pig for the question.
It's a small room. Just talk to us.
Don't worry, we can hear you.
I work for broadcasters, and I was just thinking, what should we represent on TV to sort of follow in this? We talked about intergenerational things. Maybe we should be representing like young people and old people working together, or maybe we should be framing it in health. Do some programs about, really focusing on the health side of climate change. I just wondered what your views were. Responsibility to media and
I don't mind starting. I mean, personally, I quite like the image of older people, not necessarily old, but older people, definitely with younger people. I do think that's quite a powerful visual, because the reality is many of us live in communities which are intergenerational, and families by nature are intergenerational. I was struck by something that we saw on the video at the very beginning. We need new symbols. And I'm not saying this because I want to shock, but I think we have become a little bit desensitized to some of the images of kind of icebergs melting or a stranded polar bear. I remember at the very beginning of COVID feeling personally really shocked by seeing people wearing masks. Now, got really used to it. And I kind of wonder, what is the opportunity to create some of those new symbols? To A, shock, because time is of the essence, but I do think we need to give people some hope. So how do you get that bridge of don't faff around versus actually, but you have got something to get involved with? Those would be my thoughts.
Yeah. I'll jump in next. So, I mean, I think kind of the intergenerational angle is really, really important. And I'm actually speaking at an event in the Blue Zone on that on Friday. So do come along to that. I think the thing that I find really tricky about intergenerational dialogues is like, it basically poses the idea that not all dialogues are intergenerational. And I think we just need to embed it, that actually there are always a plethora, a multitude of perspectives on problems. And what we tend to do when we are debating or discussing issues is go to the experts. And expertise is an industry that has been dominated by a certain type of person for a very long time. And I think we just need to recognise that expertise doesn't always come in the package that we have grown to expect it coming in, right? And that young people don't have to be climate experts. They can just be experts in being young people. And that if we enable dialogues all the time that have a diversity of perspectives, I do think that's not just brilliant for the planet, it's not just brilliant for our health, but it's actually brilliant for people, because we're recognising from a very kind of a moral imperative standpoint that different perspectives help us get to better answers.
Yeah, I would echo what's already been said. The only thing I might add is, I mean, everything we've said today, certainly with health and climate, is very important, and the impact that climate has on our health. But if I had a request, I think it would be, we give healthcare a free pass when it comes to its impact on the climate. We give healthcare a free pass because I think it's one of the industries that's extremely noble, and it's one that we're willing to make a little bit of a sacrifice for on the planet to make sure we look after people. And I don't think that's acceptable anymore. I think, and we didn't get into this today, but I mean, healthcare by its very nature is extremely wasteful, because we have to always make sure that everything we do in healthcare is extremely aseptic. That leads to a lot of waste, and that's not necessarily recycled. You think about how we organise our entire health system being very acute-oriented, patients coming in and out of acute centres. I mean, that's fundamentally inefficient, and we don't, again, think about that from a climate perspective. So if I had a request, it would be maybe to put healthcare a little bit more under the microscope when it comes to its impact on emissions and on climate change.
Great answers, great questions as well. Thank you. Any other questions? Yes.
Thank you. Is this working? Okay, amazing. So I work for a big research funder, and one of our priorities is the impact of climate change on health. And I think, as you guys have alluded to, something that really struck me is the unequal impact. So in terms of in low middle income countries are much more likely to be impacted by extreme heat, but also I was reading a story this week about how rising seawater, so you spoke about flooding, but is also causing the salination of drinking water in Bangladesh, which is causing more preterm births. People are getting, all of their salt each day from their drinking water, which is causing things like heart disease. So all these sort of knock-on impacts that aren't even, I guess extreme heat, it's really easy to be like hotter world, extreme heat, but all these other sort of further down the line issues that are also health issues. And I would just, when these are mostly impacting or worse impacting lower middle income countries, how do you think that we can make countries that are the causes of this, which is mostly through carbon emissions, to care more about that?
I suspect this will be discussed at other panels at far greater depth, but I mean, there's the obvious moral imperative. This is very important, but I don't think that always makes the case alone. Certainly when I think about this from a demographic and a healthcare perspective, when you look at what happens to communities that are unstable, or where you have severe threats to your well-being of your family, what happens is they move, and you get migration crises. We saw what happened in Syria. I mean, that was not a climate-induced crisis, but there are a plethora of reports out there today that show the future of our planet and its impact on migration. There was a report that came out in the FT last week ahead of this conference that showed something like 3 billion people by 2070 would live in unlivable conditions. Those people are not going to stay there. They're going to move around. And they're typically going to go to places where they are higher likelihood of having better healthcare systems, better access, and better freedoms. And I think that's an issue that really does drive home, unfortunately, or maybe fortunately, however you think about it. But that's not a stable scenario where you have people moving around the world en masse in fear in situations like that. And so unless we get to grips with health systems and impacts on health in low and middle income countries, then unfortunately the entire world's going to have to try and work out how we deliver healthcare for everybody, because the bottom line is climate change is happening. It's having impacts on people's health far beyond maybe the easy headlines like extreme heat. And unless we do something about it, it's going to lead to knock-on effects around the world.
It's a really interesting point you make, that those most accountable for the greenhouse gases are usually the ones that in the near term are the least impacted, because we know that that's what the data shows us, that's not the societies where it's most vulnerable. I think Jordan's point about kind of mass population migration and the real lack of stability that comes with that is really powerful. I think the other powerful thing for the wealthier nations is the very significant impact, not just on the health systems, but the basic access to food. We know that the impact of the climate crisis on our food production and the things that we take for granted is going to be really significant. And food poverty isn't going to be only experienced in those countries that are currently viewed as low middle income countries. So I think helping people see that the actions that we are taking in often Western society, we will not be immune from the consequences of it. And I think we've got a little bit of a way to go on that, to be honest. I think there is a thought that it's a little bit insulated still, and we've got to help people see that broader systemic consequence, I guess, that Jordan's talked about a number of times, it reaches to health systems, it reaches to food systems. Those will change irreversibly everyone's way of life that currently we enjoy.
And if I can take a bit of a different stance on that question, I guess. So I think Jordan and Juliet have talked a bit more about the kind of climatic and health angle. I come from a leadership development angle, and I think what I would be asking the question is, like, how are we going to develop the leaders of the next generation for whom these questions aren't things we have to persuade them to think about, but that naturally come to them? How do we develop leaders who have empathy, who have curiosity, who are systems thinkers, who naturally think about these problems in this way and recognise the longer term and indirect implications of their decisions? And I think that's a really hard problem to solve, because I think to do that, you do need to grapple with making sure that leaders are asking fundamental questions about the basic models that we exist in. So, prime example is, we've lived in a society that thinks that we can go on with endless growth. And I don't think we've asked leaders to challenge themselves on that growth model about the implications that sometimes have, that actually growth isn't unlimited and can have implications in other places. So for me, I think it's about creating the next generation of people who are thinking about those problems and embedding them in their work day in, day out. And that's a hard task.
Can I just make a final build on your comment, Sophie? Because I was struck by your comment of developing kind of curiosity. Actually, I think the big challenge is that kids are born curious. Young people are curious by nature. Our challenge is not to help that develop. It's not to squash it out of them. Often that's what we're doing, is that we're removing the very essence of the curiosity, the desire to improve, the desire to learn, the desire to bring others with you. That's what kids are born with. And it's society and adults and parents that often kind of socially take that out. Maybe we've got to stop squashing things rather than how do we learn or improve them.
Yeah, absolutely. And I think, one of the biggest squashers of curiosity is time. And I think we have to be really careful of that in the climate crisis. And I think equally, as we've just seen in the health crisis with COVID, we had to make decisions quickly. And that is understandable, but that's partially because we left it too late to make those decisions. We weren't thinking about pandemic preparedness properly well in advance. And I think to properly make sure we are embedding that curiosity and enabling us to explore new perspectives and new approaches, that means we have to have time. And unfortunately, we're kind of running out of that because we've spent too long, ignoring the problem, especially in the climate space. But there are other problems that are on the horizon. Mental health crisis, prime example. We need to use the time that we have got to make sure that we open those doors for curiosity.
Yes.
Hi there, hello. I'm a medical student, and I think me and a lot of other young people, and especially students, there is climate anxiety, but then there's also a lot of optimism and what some people might call idealism, and we come with a lot of energy, and I think we do come up against different people with different perspectives that kind of hit us with more of a realism or maybe more of a burnout from actually just living life longer than we have and having a different perspective on it. But I find those conversations quite difficult because you can sort of look at, you're both kind of coming from, I think someone described my stance on the climate as being tethered to the moon, and I said that I think we're both just tethered to different sides. And I wonder what everyone's perspective is on how to have those conversations together between different perspectives or generations with empathy and how we move forward with it, because I think we often find ourselves stuck up against each other, and I don't think either side, not that it should be sides, even want that, and I wonder how we can keep having conversations with empathy and move forward together with that. Thank you.
So I think there's two things that I'd like to say to that, and I'll be brief. The first is storytelling is often a really powerful way of bringing people together. Stories are age-old as part of our communities, and I do think stories are a great way of not imposing your perspective on another, but actually sharing your perspective, and I think that's really valuable. The second is I work with young people all the time who encounter that same thing, and the phrase that we like to use with them is constructive disruption. So, don't be afraid to disrupt. Don't be afraid to say something that is a little bit challenging and a little bit different to what everyone else is expecting to hear in the room. But do it in a way that you're not saying, well, here's me and here's you, and we are tethered to do different sites. Like, where can we find the site that we can find together that we can tether ourselves from? Or what's the kind of the hook that we can find in between us? And I do think if you go into those dialogues expecting to be disrupted, expecting to be challenged, but also knowing that you're both coming from a perspective of trying to find an answer, it can often be really useful.
Yeah, 100%. And the only thing I would add, I think, keep doing what you're currently doing. So in healthcare, one thing we are very guilty of, and so I'm a medical doctor by background, when you think about what doctors and clinicians do, we get very focused on our specialty in our area. We forget even, surgeons don't necessarily even care about looking at, ECGs or what's going on in cardiology. And what you're doing is already the right thing. Going not only out of your discipline, but looking at the climate, looking at other sectors, and we need to be all doing that. We all need to be thinking much more laterally around, how is what I'm doing in my sector affecting others, and how do we begin to bring new perspectives to the table? And so I would encourage you to continue what you're doing, but also encourage others to get involved and to share their views, because only when more perspectives start to fold in will mindsets start to shift and people start to understand a little bit more about what's going on.
I feel a bit like kind of old grandmother time here, but I think listening to what you've said, firstly, I applaud what you're doing. And secondly, I had a really interesting experience recently where I handed over my job for a day to a 21-year-old. And she explained to me how daunted she felt coming to do my job for a day. And I explained to her how daunted I felt by hearing her perspectives on my reality and how it did. And okay, it's a day, it's not forever, but it turned my world upside down because all of a sudden I saw the way that I'm living and doing my job through somebody else's eyes. And at the end of the day, she said to me, firstly, kind of, it had been a enlightening and different experience, and I think a positive experience. But she said to me how exhausted she was. And that was my big takeaway from the day, the way at which I live, and we've talked about time, and the way at which I often don't give time to sort of slow down and listen. I was like, wow. So I think actually for my generation, being able to stop, invite young people in to experience our reality and then tell it back to us through their eyes is daunting, it's frightening, but it's really liberating as well because it helps you think. So I'd just say go for it.
Any more questions from the audience? Yes, at the back.
So just you're talking about flooding, and there's sort of probably mental health problems related to flooding and stress, but in this country. But I think if you go to Africa and Asia, you're going to find that flooding and standing water will cause a lot of problems, vector-borne disease, and also you're going to get cholera and all the other GI diseases related to that. And I think this is going to increase, more and more. And then when you get coastal flooding, you're going to get a lot of salt water, you're going to get contaminated water, and everyone's going to have to leave places like Jakarta. And, there's 18 million people are going to have to leave because of that. So it's going to be pretty disastrous. The other point I was going to make was that, you talk about young people and empowering young people. A big problem is that lots of young people don't vote in elections. And I think a lot of young people think, well, that's not for me. But if you don't vote in elections, then the people over 65, 70 in this country, 80-odd% of them vote. And I'm not sure the exact figures, but for younger people, a lot of them just don't vote at all. And if everyone under 35 in Britain voted the Green Party, they would run the country. So if everyone under 35 votes Green, they'll run the country, and you'll get what you want. Okay.
On the kind of voting point, it's a really, really interesting question, actually. We asked young people what we thought was the most effective means of participation in decision-making, and the highest ranking thing by far was online petitions and social media. And that came way above voting. So young people genuinely don't see voting as a problem, and actually as a particularly effective way of influencing change. And I think there's two ways of looking at that, right? So there's the first way, which is saying, how can we get more young people to vote? Because that is an existing mechanism for young people to influence change. And, I've talked a little bit about the fact that we don't really have much young people, much youth representation amongst parliamentarians, amongst people that you can vote for, and I think that's a problem. But actually, more interestingly, I think, why are we not evolving the way we think about democracy and we think about the way that you can participate in decision-making? If young people genuinely feel that online tools are the best way of doing it, why aren't we evolving better ways of involving online participation on our work? And I do think the pandemic has really changed that. You've got councils who are doing their meetings on Zoom now. You can dial into and listen to some of COP26 via the UNFCCC website. I mean, the pandemic has not been a good thing, point blank, but there are some things coming out of it that are really beneficial, and I do think can be very empowering to bring young people into the debate and the dialogue. Although, as I say, that is not a remedy for the fact that you also have to use existing mechanisms, such as voting.
One more question. Great.
Thank you. Thanks for your leadership on all of this. I'm curious about the cures. So do you have any examples of startups working in this space that you're particularly excited about, or where we might discover them, because we are a funding platform for climate startups? Thank you.
To clarify, is it so just climate-focused startups or healthcare, or what?
Across the board for climate, yeah, but particularly interested, obviously, in healthcare.
Yeah, I mean, I can certainly speak a little bit about healthcare. I'm not so close to some of the work going on in climate startups. But so there are two ways in which we can decarbonize health systems and what we're currently seeing. The first is, how do we reuse and recycle better in healthcare? And so fundamentally things like, surgical equipment or other pieces of equipment, that's heavily plastic at the moment. How do we shift towards reusable materials that can be adequately sterilized or entirely remade? And there's a lot of work going on in the sort of med tech space at the moment. And I can certainly connect with you after to talk about some specific companies. The second big trend is regarding sort of energy, the energy supply for health systems. How do you make the way in which we deliver healthcare more sustainable in terms of how it's stored? Now, what we're seeing is a much broader transition of healthcare in the hospital to healthcare in the home. And that's a great thing for healthcare. It's a great thing for the way in which we're going to improve the preventative healthcare measures, but it's a bad thing for the environment. Fundamentally, it's actually a lot more inefficient. The way in which we currently deliver healthcare in the home, driving around, thinking about all of the separate sets of equipment you have to independently create and distribute amongst different teams, is very inefficient. There's a lot of work going on with sort of healthcare home delivery services that are completely decarbonising or working to decarbonise part of that process. So happy to connect afterwards and talk a bit more.
Maybe a couple of builds, because I kind of work for a large organisation, so I'm less familiar with the startup landscape. But what is critical in the healthcare sector if we look really broadly, is the sort of heat and power. So actually renewable power is really key. So our manufacturing processes for medicines, by nature they're often aseptic. They're quite power hungry and quite heat hungry processes. So actually for the industry, one of the big kind of supply chain challenges is driving to renewable power and heat. That's kind of going to take a significant part of the carbon emissions out, at least from the sort of sector that's making the products. Big opportunity to go out.
Thank you so much. I really want to thank the audience here today. We've had some really, really great questions. We didn't even have time to get to the online questions. So for those of you joining us online, if you do want to direct your questions, to be honest, I've been reading through them. Most of them have been covered by the room. If you feel your question wasn't answered, I'll ask them to reach out to you on LinkedIn if that's all right. Perfect. So I'm afraid that's all the time we have for questions. There's a short video and then I'll close. If we could show the video. Thank you.
Crisis has the potential to be greater still, impacting our planet irreversibly. Over 4% of global greenhouse gas emissions come from the healthcare sector. So everyone involved in delivering healthcare has a role to play in creating a more sustainable future, from scientists in the lab to hospital teams on the ground. Our future depends on healthy people, healthy societies, and a healthy planet. But progress is impossible without change. We must design our healthcare systems to be more resilient and ensure that people around the world can access services and care, whoever and wherever they are. Net zero patient-centric healthcare is critical. At AstraZeneca, we're playing our part. We've reduced our greenhouse gas emissions by 60% since 2015. And in 2020, over 99% of our purchased electricity came from renewable sources. The latest science and technological innovations are playing a significant role too. Digital healthcare is helping to treat patients at home, and AI is advancing medical discoveries and earlier diagnosis. These developments are improving patient outcomes in ways that are respectful of our planet. We are transparent in sharing our progress because the health of the planet and of our future generations depends on actions, not pledges. As we've demonstrated throughout the pandemic, AstraZeneca is unwavering in our commitment to support society through its greatest challenges. We continue to partner with governments, healthcare systems, and communities around the world to accelerate a sustainable future today.
Great. Thank you so much for joining us here today. A fantastic audience, both in the room and online. Lots of questions coming through. So our next session is at 12, the Global Water Gap, with a very special guest appearance you won't want to miss. So thanks again, everyone. Hope to see you soon.